What if the secret to the perfect Hollywood smile is actually a permanent biological trade-off that most people are never fully told about? You see them everywhere on social media, dazzling, symmetrical, and impossibly white teeth. But beneath those thin shells of porcelain lies a reality that is irreversible and life-changing. Today, we are uncovering the complete truth about veneers, from the clinical precision of the procedure to the long-term biological risks that every patient must understand before sitting in the dental chair. This is the definitive 2026 guide to cosmetic dentistry, dental aesthetics, and the science of smile makeovers. To understand veneers, we must first look at the anatomy of a tooth. The outermost layer, the enamel, is the hardest substance in the human body. It protects the sensitive dentin and the living pulp chamber inside. In a traditional porcelain veneer procedure, a dentist must perform what is known as enamel reduction or preparation. This involves removing a specific amount of your natural tooth structure, usually between 0.3 to 0.7 millimeters, to create space for the porcelain shell. While this sounds microscopic, enamel does not grow back. Once it is gone, the tooth is permanently altered. There are two primary types of veneers dominating the industry today: porcelain veneers, often made of high-strength lithium disilicate like EMAX, and composite veneers, also known as dental bonding. Porcelain is the gold standard for aesthetics and durability. It mimics the light-reflecting properties of natural teeth and is highly resistant to staining. Composite veneers, on the other hand, are built directly on the tooth using a tooth-colored resin. While they are more affordable and require less initial tooth reduction, they are more prone to chipping and discoloration over time. The choice between these materials is not just about price, it is about the long-term structural integrity of your smile. The clinical process of a smile makeover is a masterpiece of digital dentistry. It starts with a digital smile design where your facial symmetry is analyzed to determine the ideal tooth shape. After the teeth are prepared, impressions are sent to a laboratory where master ceramists handcraft each veneer. During the interim, patients wear temporary veneers, which often provide a glimpse into the functional changes in speech and bite alignment. The final bonding process involves a sophisticated chemical fusion between the tooth's etched surface and the porcelain, creating a monolithic structure that can withstand the immense forces of mastication. Before we move into the critical risks and the long-term maintenance of veneers, please subscribe to Dental Vision 3D Animation. Our goal is to provide you with the highest level of dental education through advanced 3D visualization. If you have already had veneers done or are currently considering the procedure, please leave a comment below and share your story with our global community. Your history could help someone else make a life-changing decision. Also, be sure to send this video to a friend who is dreaming of a new smile but needs to know the scientific facts first. Now, let us discuss the risks because transparency is vital in medical aesthetics. The most common immediate side effect is tooth sensitivity. Because the protective enamel has been thinned, the underlying dentin is closer to the surface, making the teeth more reactive to hot and cold stimuli. In some cases, if the preparation is too deep, it can lead to pulpitis, which is inflammation of the tooth's internal nerve, potentially requiring a root canal treatment later on.
There is also the factor of longevity. Veneers are not a one-time investment, they are a lifelong commitment. The average lifespan of a high-quality porcelain veneer is 10 to 15 years. Eventually, they will need to be replaced. Every time a veneer is replaced, there is a risk of further tooth structure loss. Furthermore, gum recession is a natural part of aging. As the gums recede, the margin, the point where the veneer meets the natural tooth, may become visible, creating an aesthetic line that requires intervention. However, the benefits can be profound when the procedure is done correctly for the right reasons. Veneers are a powerful solution for correcting severe tetracycline staining that professional whitening cannot fix. They can close large gaps known as diastemas, correct minor misalignments without years of orthodontics, and restore teeth that have been worn down by acid reflux or bruxism. For many, the psychological impact of a restored smile leads to a significant increase in self-confidence and professional success. To ensure your veneers last as long as possible, your oral hygiene must be impeccable. You cannot treat veneers like natural teeth when it comes to mechanical stress. Habits like nail biting, chewing ice, or using your teeth as tools can cause the porcelain to fracture or debond. Furthermore, patients with bruxism, the habit of grinding teeth at night, must wear a custom-fitted occlusal guard to protect their investment from the massive pressure of nocturnal grinding. If you are not ready for the irreversible nature of porcelain, there are alternatives. Prepless veneers, such as lumineers, require little to no tooth shaving, though they are only suitable for specific dental alignments. Professional teeth whitening combined with clear aligner therapy like Invisalign can often achieve a beautiful result while keeping your natural enamel completely intact. BioClear and other injection molding techniques are also emerging as a way to close gaps with less invasive measures. The truth about veneers is that they are a remarkable intersection of art and science, but they come with a biological cost. They are a treatment, not a product. When performed by a skilled cosmetic dentist using conservative preparation techniques, they can safely transform a life. But when rushed or done unnecessarily on healthy, straight teeth, they can lead to a cycle of dental work that lasts a lifetime. Knowledge is your best tool. Understand the materials, respect the biology of your enamel, and always prioritize the health of your foundation over the brilliance of the facade. Understanding the physiology of your smile is the first step toward a healthy, lasting transformation.